Okay, Dr. Seva, you have any a little bit topic? You
No, I have nothing
also
else.
attend in our.
I have nothing else.
Nothing, just waiting for the question, right?
Yes, I'm here for the questions. Yes.
So now we have about 11 minutes for the question and answer. So I don't know that who want to share or like to ask something. The one that asked Selva, that how do you ensure that the bowel are moved out of the way? Selva?
Yeah. This is my friend Dr. Eileen from Philippines. Yeah, there are several things that we do to move the bowel away. Of course, the first is before the surgery, we have to prepare the bowel to make sure the bowel are not filled with any fluid and less air. That's the first step. The second step is actually, and also we must, the MRI, we must be able to ensure that the bowel is not sitting on top of the uterus. Patients who have had previous myomectomy, previous adenomyoectomy, these are dangerous patients. They may have bowel adherent to the uterus, and if we can see that on MRI, we will not do surgery, not do Haifu for them. So only patients who do not have adhesions of the bowel, especially to the anterior part of the uterus where the fibroid or the adenomyosis is, that we will do Haifu. During the surgery, during the procedure, Haifu procedure itself, there are several techniques that we need to learn, and this is something that I'm still learning. One way is actually to use the bladder to push the bowel away. In some patients, we fill up the bladder, and the bladder itself will move the bowel away. The second way is actually we have got something called a balloon, which only when you do Haifu you will understand. It's a balloon that is placed between the patient and the probe. And that balloon is placed in such a way that we can push the bowel away. So when you start doing Haifu, then the Haifu doctors will teach you how to do it. And you will learn that you can push the bowel away. Of course, if you cannot push the bowel away, you will not be able to ablate that areas where the beam is going through the bowel. So you will be ablating only more on the foot side and not on the head side. And it's one of the disadvantages of Haifu. So sometimes we cannot reach the what we call as the fundal side of the fibroid adenomyosis, and that may be spared because it's obstructed by the bowel during the pathway. So when you start Eileen, then we will understand this better.
Yes, yeah, sorry. Yeah, I'm totally agree with the opinions because when we doing the Haifu, we should take care about the bowel, and sometimes we use the balloon to push the bowel weight, and the turner of the sound is very important. I think that we should have some experience. And some audience ask about as a gynecology, can we perform Haifu? That's right. Actually, in the Asian regions, most of the Haifu was performed by the gynecologist, and so especially for the minimally invasive surgeons in our group, especially for the APAGE group, there are so many pioneers. In here, they are learning how to perform Haifu, just like the silver. And later on, they will have Osamu Susumi, and also the Dr. Guo, and also the another is about the Nikiwai is very famous, and also many doctors is begin from the minimally invasive therapy, then shift to Haifu treatment. So I think that is quite good because one is the minimally invasive, and Haifu is we can say the micro invasive therapy for the patient. So I think that is a very nearby between the two techniques. So I encourage every one of you, every endoscopist should learn how to perform this micro-invasive or non-invasive technique.
So I think it's really interesting, the HIFU treatment, but I think many one is wonder why we use HIFU instead of like a laparoscopectomy. What is the good candidate to choose like okay, this case I will choose a laparoscopic myomectomy or adenomyotomy, or this case I will choose for the HIFU. Maybe Professor Chyi-Long Lee first.
You know,
how you choose the case that okay, this case we choose a HIFU.
Yes.
What is factor?
Yes, actually, every time when we perform the laparoscopic adenomyotomy, we always have a very strict goal, because you know, even we doing the very good endoscope surgery, laparoscopic adenomyotomy sometimes is still very difficult, especially diffusion type. The diffuse adenomyosis, then whenever you perform the adenomyotomy, they always have some tissue is not so good left there. We hardly can complete resect of the adenomyoma. So in this situation, it's very struggle for the surgeon. You know, as a surgeon, we will do our best. So we like to remove it all, not left a little bit tumor, just that we got the matchback debunking the concept in the cancer surgery. So in the adenomyosis, we would like to remove it all, but it's always very difficult for us to remove it all. So it means sometimes they have some tissue left there, and should we go a little bit further, there will be struggle during the surgery. So actually, most of the case, if they is not the tumor is not a myoma, I would prefer to more conservative for the patient, because of the adenomyosis is have a very influence on the fertility that is a question. So in the not involved to large size of the adenomyoma, maybe the woman can get pregnancy without any treatment. But some of them, if we get them some just like a dianogeston or just Visan or DNHA, they were very easy to get pregnancy. But if you did not have a very good surgeon in performing the adenomyotomy, then the outcome will be very poor. So actually, in here, I want to ask most of the endoscopists, if you want to have an adenomyotomy, you have better to have a more than 50 myotomy experience in doing the myoma resections. Otherwise, don't do the adenomyotomy because it's quite difficult to perform. Especially if you want to have remove it all, it will be very difficult. So if they have a chance to have a medical treat, I would rather to have a medical treat. If not, if he can afford HIFU, I will advise them to do HIFU. If not, and they will get the repeat IVF failure, then the adenomyotomy I will suggest to do. Yes.
Okay, thank you so much. And Seva, you have any more answer?
Yeah, thank you, Amphan. I will first talk about adenomyosis, then maybe fibroid. So your question is, how do you decide when to do surgery and when to do HIFU? I mean,
how do you choose?
I just started doing HIFU from this 12th of July. Just 3 months, slightly more than 3 months, 3.5 months. And I did my 63rd case yesterday. So I get referrals from doctors mostly are adenomyosis. In fact, 2/3 of my patients are adenomyosis, and I'm an IVF specialist. So I have a lot of friends with IVF specialist patients, doctors. And what they do is they send their difficult adenomyosis to me. They have done everything. They have given GnRH analog. They have tried IVF. There are two groups of patients actually. One group is patient who want to get pregnant, and the other group is a patient who have a lot of bleeding and a lot of pain. And so they, the ones who have a lot of bleeding and pain and who have already completed their family, those are easy. Those patients are easy because they refuse hysterectomy and they don't want to do adenomyomectomy. Everybody will tell them to remove the uterus, but they don't want to have hysterectomy. So they are sent to us to do Haifu. So I perform the Haifu in the hope that we will shrink the adenomyosis and the patient don't have to have a hysterectomy. But the other group of patients are the ones that are very difficult, those patients who want to get pregnant. Now, adenomyomectomy, I've been doing adenomyomectomies and I don't get good response with adenomyomectomies, and I always worry about uterine rupture. I have not got a single patient of uterine rupture because I don't do that many adenomyomectomy. I realized that Haifu will be a better choice than adenomyomectomy because generally we can actually ablate most of the adenomyoma and there is good shrinkage. Now, I told you I've only started 3 months. If you let me share, I can show you 2 patients I saw today whom I did Haifu about 3 months ago, and they came back today. Maybe if somebody can allow me to share, I can show you the result of these 2 patients, and it's actually very good. I tell my patients that this is the last chance. If you can shrink the adenomyosis, fine. You can try to get pregnant. If it doesn't, what other choice do you have? You can go and do the adenomyomectomy. So maybe Jenny or somebody can let me share the screen. Can I? Yes, I will show you these 2 cases that I showed this morning. Okay, this is I think case number 1. So this is the patient. She has this adenomyosis. She's actually 23 years old. She's just single 23-year-old girl, and she has got this adenomyoma. And this is their adenomyosis, and we did the procedure. Oh dear, the photograph didn't come out. Be replayed because the computer maybe. Oh, sorry, I couldn't show the video. The photographs that's not coming up. I'm sorry. So what she had actually, the first time we did just before the surgery, her volume was 495.1. Sorry, the photograph is not coming out. Can you see it on the Zoom? I think you can't see. Can you see it?
Oh, no,
you can't. So, but I'm sorry about that. But today when she came, her volume was 239.4. So there's a 51% reduction. The photographs are there, but it didn't come up. So the other patient is a similar patient. Let me see. This one you can see, isn't it? This is a second patient. This video has come up. This is the second patient. This patient is a bit older. She is 46 years old, but she doesn't want to get pregnant anymore. And this is her MRI just before, so it's done on the 19th of July. And the measurement was 600 centimeter cubed by calculation. This is the ablation that was done. This is done today. This is the MRI today. And you can see that the reduction is 58% reduction in the volume of the uterus. And she's very happy. So, this is the advantage of Haifu for this kind of patients, that we are not very happy to do the adenomyomectomy, and these patients have tried everything, have failed, and so this is another option for them. So that's adenomyosis, as what Professor Chyi-Long has mentioned. As for fibroids, patients are excited because when they have a fibroid and you tell them that, I don't need to do surgery, I can do this, I can kill this fibroid by Haifu, they get excited and they want to do Haifu surgery. But I don't get all those nice 5 centimeter, 10 centimeter fibroids. I get the ones that are 22-week size uterus with many fibroids, 2 or 3 operations done before, and nobody wants this kind of patient, and then they send them to me. So we try our best to try and shrink this fibroid, but ultimately that will be a decision of the patient whether they want to choose to do laparoscopic myomectomy or they want to do Haifu. And I always tell them that when I do, I always tell them the benefits and the risk and benefits of myomectomy and Haifu. I say I can do both. I can do a laparoscopic myomectomy. This is an 8 centimeter fibroid. I can do a laparoscopic myomectomy easily. The advantage is that the whole fibroid is removed. We repair the uterus. You don't have any more fibroids. Whereas if I do the Haifu, you don't have any surgical scar. you can go back to work tomorrow or day after. But there is a 90% success rate. There may be a 10%, maybe 5% to 10% that the fibroid will not shrink. Of course, we choose our fibroids very carefully. Those fibroids that are non-vascular, very easy to access, that can be done. But currently, all the fibroids that are doing are all the ones that nobody wants. Everybody don't want to do this kind of fibroids. They send it to us to try and do. So we help them. We try to shrink the fibroids for them. So that's basically it. But ultimately, I think it's the patient who decides which one they want. Somebody asked whether there is benefits for fertility. Of course, there's benefit. If you have a good fibroid, a very hypo-intense, dark fibroid that responds very well, you do a Haifu for them. After 3 or 4 months, it shrinks, they can get pregnant and they don't have to worry about uterine rupture, they can deliver normally. So it's a matter of what the patient wants to, choice is. I hope I answer your question, Amphan.
Okay, very good. But I think I like to ask Dr. Kuo. He didn't talk anything after his topic. The question is, how do you know what the uterus is ready to be pregnant? I don't understand this question also. Another one is anesthesia, what you use. It's not anesthesia, but you use some light anesthesia, what you use also. Maybe Dr. Kuo first, and then Seva.
Excuse me, you hear me?
Yeah, sure.
Okay, can I ask the question again? The first one is, how can I see the patient is ready for pregnancy?
Yes, after Haifu.
Oh, after Haifu, because the experience, okay, because there are comparing to myomectomy, Haifu myomectomy, Haifu ablation for uterine myoma have far more rare instance for you to have a uterine rupture when we got pregnancy. So currently we believe that there is no definitely answer to how many times after Haifu we can get pregnancy. But currently we believe that we need to have observation time for 3 to 6 months. So after Haifu 3 to 6 months, the patient can get pregnant. Okay, it's the first question. So can I ask another question again?
Another question is anesthesia, that light anesthesia, what you mentioned, what is kind of anesthesia that we used?
You say what? Significant? No anesthesia.
Maybe petidine or morphine or something.
Oh, anesthesia drugs,
yeah,
right?
anesthesia.
Because there is just an anesthesiologist in the Haifu, so they just give some medicine to let the patient sleep. So I don't know definitely the drugs. Yeah.
It depends on your colleague, right?
Yes.
So and I think it's unfortunately the time is over, but I think if our speaker like to talk something a few minutes, I think this might be better for our audience. Seva, what you like to talk?
Yeah, Amphan. Firstly, I mean, I agree with Dr. That we wait for 3 to 6 months for the patient to get pregnant. But if the fibroid shrinks, if it shrinks to half the size, then we can tell her go and try and get pregnant if they want to try pregnant on their own. As far as anesthesia is concerned, I'm very familiar with this because we just started and we were all struggling how to do it. So what we give is we give fentanyl and we give domicum, which is midazolam. Midazolam and fentanyl are titrated very, very low dose. In fact, for a 2-hour surgery, Haifu surgery, we only use 5 milligrams of midazolam and maybe 200 micrograms of fentanyl. So very low dose. So it is given every 20 to 30 minutes, and we call it a conscious sedation. That means we're actually talking to the patient while they are doing. So it's very, very low dose. Imagine 5 milligram midazolam given over a period of 2 hours. It's very, very micro dose. And it is calculated, I think something like 10 microgram per 30 minutes or something in that line. So one thing I must say is that in some patients, they will suffer some pain, especially adenomyosis when we do Haifu, because we want them to feel the pain. We want to know where the pain is, because what we are most worried is whether the pain is going to the nerves. So we will keep asking the patient where you feel the pain, whether the pain is in the two areas that we're worried about is the pain on the skin and pain on the nerves. If they say that the pain goes down the legs, then we know that the heat is going laterally to the nerves, and then we will reduce or move the ablation to another side. As far as skin is the same thing, we will keep asking whether the patient feels any skin pain, skin burn. If they do, then we will stop and then move to another side. So these are two things that we know. And this is most important when we're doing Haifu, because we want to not cause complication. So there's a reason why we are doing it under conscious sedation. I hope you understand. I hope they get.
You really give the detail. So I think the time is already over. Okay. So I think I like to thank you, our speaker, that for your great contribution to our webinar today, and also our audience that you follow our webinar until the end. So maybe we will advertise the next webinar that you would like to join the 4th episode.